Okay, and then what ages and different types of munchies are there?
Yeah, so we go across the lifespan. And as I said, originally it was developed for oral health and hygiene periodontal condition for adults. And certainly it's super relevant for adults still. And we had research done in the speech pathology department here in Newcastle around the benefits in an aged care situation where they have a lot of issues with aspiration, pneumonia, and dysphagia. And we're looking at, so we did a fantastic study there with utilising a munchie to help keep the chewing faculty functioning. So it's a really useful tool across that adult lifespan still, adult ages still. But my big passion and interest has come right down to children and even to babies. So that's where a lot of my focus has been. And I've developed the baby munchie. We call it the Bebe. The Bebe munchie is for babies from about 5 months of age, because we know at that sort of age, that's when all of the activation of the chewing responses as opposed to reflexes are occurring. So the babies have this chew reflex going on where you put your finger back on the gum and they will chomp. It's a chomping reflex. So they're getting some activity there. Where they start to get to the point where we want them to start to be able to manage food, solid food being brought into them, this is when the Bebe munchie is a perfect tool, because the activation of these chewing responses and the tongue lateralization and all of that activation and change around from the suck, swallow, breathe to the chew, swallow, breathe, that's the big functional movement that will take them through life, that's synchrony. And so that's why we developed the Bebe munchie, because it's a perfect tool to bring in around that age. And it's all about that neurosensory information back to the brain. So there's so much information, lower third of the face. You're working with that community all the time. The level of complexity is huge. So there's a lot of brain space taken up for the lower third of the face. And so what we want to make sure with those babies is that they get the opportunity to really activate those chew responses. And the Bebe munchie is a great way to do that. And it's a really great way to educate parents as well about what's appropriate for this age, because we're seeing a lot of overuse of pacifiers. That's one of the biggest things that will interfere with the way the chewing responses should be developing, and the chew, swallow, breathe synchrony should be engaging, and that tongue, oral rest posture, the swallow, all the things that we know how significant they are when they're not working well. So the Bebe munchie is fantastic to use with that age group, up to about 18 months to 2 years.